Hello, everyone. My name is Misty. Thank you for being here. Today, I'm going to talk about 8 common myths about suicide. Suicide is a growing public health crisis, according to the National Institute of Mental Health. It's the 11th leading cause of death overall. With more than 48,000 suicides in 2021 in the US, it's the second leading cause of death for people 10 to 14 and 25 to 34. And the third leading cause of death from people 15 to 24. Even though suicide isn't predictable, it can be preventable by addressing social, cultural, and environmental risk factors. Myths and misconceptions about mental health shape people's beliefs and attitudes about suicide, which can be a significant barrier into seeking help for themselves or their loved ones. Here are 8 common myths about suicide. Myth number 1. Talking about suicide increases the chance a person will act on it. The fact is, talking about suicide may reduce rather than increase suicidal ideations. It improves mental health related outcomes and the likelihood that the person will seek treatment. Opening this conversation helps people find an alternative view of their existing circumstances. If someone is in crisis or depressed, asking if they are thinking about suicide can help, so don't hesitate to start the conversation. Myth number 2. People who talk about suicide are just seeking attention. The fact is, people who die from suicide have often told someone about not wanting to live anymore and that they don't see a future for themselves. It's always important to take seriously when someone talks about feeling suicidal. It's important to be kind and sensitive and ask direct questions, including, are you thinking about hurting yourself? Or, are you thinking about suicide? Do you have access to weapons or other objects that can self-harm or harm yourself? Don't ask these questions like expecting a no answer, like, are you going to kill yourself? Be genuine, be actually concerned, and be kind. Myth number 3. Suicide can't be prevented. The fact is, suicide is preventable, but unpredictable. Most people who contemplate suicide often experience intense emotional pain, hopelessness, and have a negative view of life or their future. Suicide is a product of genes, mental health illnesses, and environmental risk factors. Interventions targeted to treat psychiatric and substance use illnesses can save lives. Myth number 4. People who take their own lives are selfish, cowardly, or weak. The fact is, people don't die by suicide by choice. Often, people who die of suicide experience significant emotional pain and find it very difficult to consider different views or see a way out of their situation. Even though the reasons behind suicide are quite complex, suicide is commonly associated with psychiatric illnesses such as depression, anxiety, bipolar, schizophrenia, and substance use. Myth number 5. Teenagers and college students are the most at risk for suicide. The fact is, the suicidal rate for this age group is below the national average. The age groups with the highest suicidal rate in the US are women between 45 and 64 and men 75 and older. Although certain groups may be at a higher risk, suicide is a problem among all ages and groups. Myth number 6. Barriers on bridges, safe firearm storage, and other actions that reduce access to lethal methods of suicide don't work. The fact is, limiting access to lethal means of harm, such as firearms, is one of the most straightforward strategies to decrease the chances of suicide. Many suicide attempts are a result of impulsive decisions. Separating someone from a lethal means could provide a person with some time to think before harming themselves. Myth number 7. Suicide always occurs without warning. The fact is, there are almost always warnings before a suicide attempt. Here are a few common signs: being preoccupied with death, dying, or violence, changing a regular routine, including eating or sleeping patterns, doing risky or self-destructive things, such as using drugs or driving recklessly, feeling trapped or hopeless about a situation, giving away belongings or getting affairs in order when there is no other logical explanation for doing these things, having mood swings, such as being emotionally high one day and deeply discouraged the next, thinking about suicide, making statements such as, "I'm going to kill myself. I just can't take it anymore. I wish I were dead," or "I wish I hadn't ever been born," and withdrawing from social contact or wanting to be left alone. Myth number 8. Talk therapy and medications don't work. The fact is that treatment can and does work. One of the best ways to prevent suicide is by getting treatment for mental illnesses, such as depression, bipolar illness, and substance abuse, and learning ways to cope with problems. Finding the best treatment can take time, but the proper treatment can significantly reduce the risk of suicide. If a friend or loved one talks about or behaves in a way that makes you believe they may attempt suicide, don't try to handle the situation alone. Encourage the person to call a suicide hotline number and get help from a trained professional as quickly as possible. You are not responsible for preventing someone from taking their own life, but your intervention may help them see other options are available to stay safe and to get treatment. How can you help someone who has suicidal thoughts? Talking with them in private, calmly listening to their story without judgment, telling them you care about them, taking what they say seriously, and asking directly if they are thinking of suicide. These are things that happen. Thank you for taking time to listen, and I just want to encourage you to reach out for help if you're feeling this way or know someone who is. Put on the full armor of God and pray for protection from God. Thank you very much. If this has helped anyone, please share this video. And if you need a prayer request, please comment. Thank you.